Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome from the ad break. You are still watching Prime Life. We did promise that on a Tuesday, we give you all things that have to do with wellness. Now, on the 17th of May, which was on a Saturday, it was World Hypertension Day. And in studio, joining us is Ronald Abvajee, who is our wellness expert. And we will be speaking to him regarding World Hypertension Day that took place on Saturday. Now, Ronald will be sharing his expertise and insights on the importance of maintaining a healthy blood pressure, the risks that are associated with hypertension, and practical tips for incorporating lifestyle changes to support optimal heart health. Assalamu alaikum. Thank you so much for joining us.
Wa alaikum salam. Always good to be with you.
Jazakallah so much. Now, before we actually get into our conversation, I think we have a discussion or a clip that is by Dr. Marlin McKay, who will tell us more about the definition of hypertension for those who do not know. So let's take a look.
So hypertension is a medical term for high blood pressure. As you know, your heart is one of the major organs in the body which is responsible for pumping blood throughout the body. And it has to generate a certain amount of pressure in order to do that. And so one talks about normal blood pressure being anything below 140/90. And the moment the heart has to generate a pressure higher than that, that's when you talk about hypertension. So hypertension by definition is the measurement of a pressure in a patient, the blood pressure, which is regarded as above 140/90. So remember, hypertension by and large, because there's no cause, we can't find a cause, we can't cure it. And another interesting thing about high blood pressure is that there's no symptoms. So patients, or very few symptoms, so patients can live with hypertension for a long time without even knowing it, and that's why we call it a silent killer. But having high blood pressure is associated with a few things. One, stroke. Two, a heart attack. And three, kidney damage. We talk about hypertensive nephropathy, where it can cause severe kidney damage to the point that you may need dialysis and even a kidney transplant.
That was very informative, and I think it kind of paved the way on what hypertension is, and for those who did not know. But I'm just going to get into my conversation with Ronald Abvajee. So can you please expand on the impact of hypertension on kidneys, particularly in relations to hypertensive? You know what? I'm going to say this word, but I'm not a wellness expert, right? And he has refused to give me insight on how to say it. So let's give it a try. Hypertensive nephropathy. Is that how you say it?
You did not adhere to the warning beacon that is Maimuna's outfit, but you've got it as a green light, 100% correct.
Thank you so much.
So hypertensive nephropathy is to do with the kidneys. And we know that, as Dr. McKay explained, hypertension is when there's increased pressure on your blood, on your valves. The valves on your capillaries and your blood vessels. So that includes the small filtration vessels in the kidneys. And when those get impacted, you impact their functioning. So the kidneys' function is to maintain fluid balance, water balance, but also remove waste product. And if you affect those filtration vessels, the kidney can't do its job, which increases the risk of chronic kidney disease, which in this instance is known as hypertensive nephropathy. And did you know that in South Africa, hypertension is the second leading cause behind diabetes for chronic kidney disease? And that means that you're increasing this loop, because when your kidneys can't filter fluid and control fluid balance in the body, as well as filter waste, you increase your blood volume, which means there's additional pressure onto the blood vessels. And that's a vicious cycle that just continues because of high blood pressure.
That's very interesting that you have explained it. I mean, what are the risk factors of hypertension? But also, are there any lifestyle habits that people can, take on to avoid the risk of high blood pressure?
Oh, absolutely. So the risk factors that we look at definitely are lifestyle oriented. Now, before I jump onto the lifestyle, let me just say that there's also a genetic predisposition. So there could be genetic factors if you have high blood pressure or hypertension in your family history. Does it mean you will have it? No. Does it mean you're at a higher risk? Yes. But what dictates it more often than not are lifestyle factors. So things like being overweight, eating ultra-processed food or highly processed foods, salty foods, smoking as well, and stress. Those are some of the common lifestyle factors. And of course, lack of activity, physical activity, impact your risk of hypertension. Now, you asked me the second question,
Yes.
being what is it that we can do and to be aware of?
Yes.
Well, to just declare that hypertension is known as the silent killer for a reason. Experience some of the signs and symptoms, dizziness, headaches, shortness of breath, etc. And it often is a lagging indicator. When something goes wrong, do you realize, hey, I've got hypertension? For men, things like erectile dysfunction and other factors, that's what is a factor that makes them realize they've got high blood pressure. So we need to avoid ultra-processed foods, Aisha. We need to be conscious of it. Processed foods, so things like polony, Vienna, you know, the things that come in specials and vid specials and those things, wrapped in paper, that when you squeeze it, it's just drenched in oil. Those things. Also, for our fellow hosts, I know they like a particular fried chicken. That also increases the risk of hypertension. And they match the color of the box because they're also wearing an orange outfit today. So that's one thing. The second thing is lack of activity. Exercise activity increases the strength of the blood vessels, but also you got to watch how much salt you are consuming. That's one of the biggest things, because when you're consuming salt, the body retains water. When the body retains water, you increase blood volume. So imagine a hose pipe and you're adding a lot more pressure of water. It forces that blood vessel and the blood vessels to actually increase. So it increases pressure because there's higher volume of blood. And that's what salt does. It's water retention. So these are the things you got to be aware of. So you got to go for leafy green veggies, maintain your water intake, keep active, and manage your stress.
Wait, now this is confusing. You said salt causes water retention, right? But then a lot of times we hear people say things like, "Oh, you need to add a pinch of Himalayan, what you call this, the pink salt, into your water because it retains water in your body, which is good for you."
I
Is that
said
not?
that.
No, no, not you. I'm
No,
saying
I did.
it's a.
I did
Oh,
say
you
that.
said that.
I do say
Oh,
that.
oh,
Because
okay. Here
what
we
you
go.
do is when you're having water, if you're exercising, you're losing water. During the day, when you're sweating, you're losing water. And that is to do with a little bit of sodium that you release. And of course, you know, that salty taste is a sodium. And that is salt. Now, the pink Himalayan salt is a lot healthier than processed table salt. So a pinch of the salt helps replenish the salt stores in the body to give it the right balance. The minute you have table salt and you add extra salt to food and other things, or ultra-processed foods, they use salt as a preservative and a flavorant. That is additional to what we require. Did you know that in South Africa, we have double the amount of recommended table salt, iodinated salt, that we should be having a day? Now that extra moves out of the balance that your body needs of the right amount of salt. And what that then does is increase the body's ability to retain water, which increases blood volume, which increases hypertension.
Very well explained. Now let's talk about what do you call this? Natural remedies. Are there any natural remedies that people can use so that we can avoid high blood pressure?
Oh, without a doubt. If we look at salt, we get used to salt, and the taste profile of salt in our tongue means that we need more to accommodate for the taste. So change too much salt or extra salt to more herbs. You know, they still bring a different flavor profile, and you can still have food that's enjoyable and that's palatable on your tongue, but that's fantastic for your body. The second thing that we look at is the right approach to eating. Now, if you do have hypertension, there's a DASH diet, dietary approaches to stop hypertension, which is less sodium, higher fiber, which stimulates the body's ability to get the blood volume low and not to put so much pressure on the valves and, of course, the vessels.
I was actually not aware of like how little we're supposed to consume salt until last week. I think it was World Salt Day, and they were saying that you should not have more than 5 grams of salt. And I was like, oh, we are doomed because the amount of salt we have is way above that. But just speaking on the food items, let's talk about the food items that people who are living with high blood pressure can avoid, and also certain diets that they can avoid so that they can be their healthier selves.
So when you look at particular diets, there's a lot of diet trends out there. Now, if you have hypertension, you need to focus on decreasing that because that's a health risk. Like, do you know, again, 1.28 billion people globally documented to have hypertension, but I'm sure quadruple that don't know they have hypertension. In South Africa, 1 in 3 adults have hypertension.
That's a lot.
Now, when you look at the dietary approaches, I explained the DASH diet. The reality is that you need to decrease your salt intake and maximize your fiber intake and green leafy veggies to assist with that. You need to accommodate for herbs rather than salt, and you need to be aware of frying foods and the types of foods that you're using in your preparation. So canned foods that has a lot of salt in them, be very mindful thereof. And finally, remove the salt from the table. People complain often, there's not enough salt in the food. And they add additional salt to that. And that is where the highest risk factor kicks in. Because our taste profiles have become, we've reached the threshold and we've gone beyond the threshold of our taste profiles for salt. So what do we want? More
salt.
and more and more.
That is actually very sad. But let's talk about, you did mention that stress can also be one of the factors that contribute to high blood pressure. And are there any maybe ways that people can try to incorporate in their lives to manage their stress? Is there a way that you can do that?
Absolutely. But why does stress increase our risk of hypertension? When you're highly stressed, your body releases cortisol. Cortisol leads to the constriction, which is the closing of the blood vessels. Now, when the blood vessels close and you have a high blood volume, it's more pressure. So it actually compounds your risk of hypertension. So what do we need to do? We need to learn how to manage stress. I can't change stress more often than not, but I can learn how to manage it better. Things like breathing exercises. There's something called a movement sequence called the nitric oxide dump, which assists in strengthening the blood vessels. And that's when you release and force the body to release nitric oxide from the bloodstream. And then, of course, breathing exercises, mindfulness and awareness, and at times, trying to the best of your ability to remove yourself from stressful situations, either at home or at work, and find the capacity to support you to deal with it from a mental health perspective and an emotional health perspective. And if you're looking for a warning sign, just look at my munna, because that orange will definitely indicate a warning.
And now let's talk about how often should people get checked for high blood pressure? Because you did mention a lot of people still don't know that they're living with high blood pressure until obviously maybe the signs are extreme or and all of that. So how often should we go for blood tests and get checked, and what should they do if the numbers are high?
So the current data says that ideally, if you're under 40, you should go once a year if you've got no precursor risks to hypertension or high blood pressure. After 40, you go every 6 months. My philosophy is to go for the blood pressure test is so easy. Any pharmacy clinic, it's more often than not, it's a cuff on the arm and they can actually check it out. I mean, I wear the device to track mine all the time to identify when I'm stressed. So I would say to people, go every 3 months to track it, because it could change extremely quickly. If you're in highly stressful situations, your blood pressure is more often than not at a very high level, and that could lead to you eating unhealthy, not exercising enough, which compounds your risk of hypertension. And that could lead to death, because it's a leading cause of heart attacks, strokes, etc.
Thank you so much for for sharing that with us. But before we let you go, in commemoration to World Hypertension Day, what words of advice, last words do you have to say to our viewers that are watching now?
We often hear about you got to love yourself. And you can love yourself if you know your numbers. And a simple number to know is, what is your blood pressure? Because then you know what you need to do to make sure that your heart that beats so many times a day is in the best possible state to initiate and maintain life rather than take life away.
That's beautiful and profound. Thank you so much for joining us, Ronald, and thank you for helping us commemorate this day.
Always a pleasure.
Viewers at home, that was an amazing conversation that I just had with Ronald regarding hypertension, high blood pressure, and what you can do to avoid it, the foods that you need to take, the foods that you need to avoid. And, getting checked, it's also the first step to knowing exactly what's going on with you and looking after yourself. But without wasting any time, let's go to a quick ad break. We'll see you right after this. Stay tuned.